Watch me do that. Welcome back to Signals on 91.3. If you're just joining us, the Signals, you've not missed much, except that you missed the part where we were selling our businesses in 30 seconds. And we'll continue that next week, Saturday. This morning, we're looking at breast cancer awareness. October happens to be the pink month. Yes, I think I'm right. Pink month. Well, it's Think Pink Health Fair for breast cancer awareness. So I have with me, wait, before I go into the business as I don't say, because I did, what did I do again? I did marathon yesterday, so thank you to Emeka and Tokwe for pushing this. I have with me, so he's presently the Associate Medical Doctor, Head of Business Development at Lily's Women's Health. He has vast experience in health education, health promotion, and breast cancer See, let me, English is not, then delivered many lectures, sensitization, delivered many lectures and seminars in various government bodies, NGOs, and religious organizations. He's a graduate of University of Ilorin and presented at It's Plenty. So I have with me Olorunfemi, Laguda, Idris. Welcome to Signals.
Thank you so much. It's a pleasure meeting you too.
But the question is, why are you going to come and talk about our breasts? Why you?
Well, as medical practitioners,
okay, defend that.
All medical practitioners don't have a gender. Either we're male or female, we can attend to anyone.
Okay.
Whether it's a male or a female. Even a female can see a male doctor and still...
but you know, sometimes we have... A lot of people still have preferences to who they want to.
Yes, of course, it's their right. And it's
until
their
when it's
choice.
time to do surgery. Okay, so we're talking the month of October is Breast Cancer Awareness Month. How can we educate the younger generation about breast cancer and what they need to do often? Let's start with that.
Okay, thank you very much. First and foremost, I would like to appreciate Lagos Talk 91.3 for giving us this opportunity to present to the populace concerning this breast cancer awareness month. This is just one of the avenues where we can educate the people, especially the young generation, concerning breast cancer. Other ways, of course, the young generation, they already have social media privileges, Facebook, Instagram, Twitter, and so on and so forth. So that at that point, we also have these social media handles where we can educate them and post a lot of topics and thereabout concerning breast cancer, and they would also be educated. And also, we also organize seminars, workshops, lectures, and all that for religious bodies, NGOs, and these young people can come together and learn more about breast cancer, because breast cancer can even, a lot of people believe breast cancer affect only the elderly people, but that's very, very wrong. Breast cancer can affect anyone, young, old. In fact, last week I just heard of a 21-year-old lady diagnosed with breast cancer. So we all have to be very, very careful. We all have to do our breast self-examinations, go for our breast scans. If we're over 40, we'll go for our mammograms, visit your doctor regularly, and I'm sure later we'll talk about the preventive measures and so on and so forth.
Okay. Let's even start with what is breast cancer? What's that cancer? Let's do science a little bit.
Okay. I know I'm a medical doctor, but I will try as much as possible to break it down, because
even when you were writing self, I was not sure that you're not writing doctor's prescription for me.
My handwriting is actually very good.
I could read a little.
Yeah, that's true. Okay, so I'll try and break it down into layman's terms. Before we talk about cancer, I want everyone to understand that every living organism comes from what we call a cell. The cell is the structural and functional unit of life, the basic structural and functional unit of life. And from the cells, they divide, they multiply, and they form tissues, they form organs, they form systems, and that's what forms us as an individual. If a single cell should start dividing more than the others, that means they go renegade, they become criminals, they start dividing more than what is necessary, then it becomes what we call a tumor. Tumor, T-U-M-O-U-R. Now, there are two types of tumors. There's a benign tumor and the malignant tumor. The benign tumor will just grow rapidly, but will just stay at that particular tissue. For example, the breast. Some people will have lumps in the breast, but they don't spread to other parts of the body. So that particular tumor is a benign tumor. That tumor does not kill. However, the malignant tumor, that is the cancer that everybody should be afraid of, because that tumor grows, it multiplies, and it can even invade nearby tissues and disseminate to other parts of the body, and that's what we call metastasis. And if it occurs at that particular point, that's stage 4 breast cancer, and it's just a miracle for that person to survive. And that's the reason why early detection saves lives. Early detection saves life. We have to nip it in the bud while it's still early, and that person has a higher chance of survival than allowing it to grow rapidly, disseminate, spread to other parts of the body, and it's just a miracle for that person to survive.
Okay, so you are taking us through the science.
Yes,
right?
please.
Before we even get to stage 4, because we mentioned benign.
Yes,
now,
please.
This year we rise to ensure every woman has access to the screenings she needs,
Yes,
and the
please.
support that she deserves. Now, in the part of this world where we don't take things seriously until we get to the hospital and we're being told it's stage 4.
Yes,
When
please.
is stage 1?
Okay.
Before stage 1.
Okay, thank you very much. Let me just start like this. There are many symptoms of breast cancer. The very first symptom is a lump. A lump is what Yoruba people call koko. It's just like when you turn pap and you don't turn it very well, and it starts forming lumps inside. So that's what we call koko, lumps. So that lumps can form in the breast. So when you feel it, and you feel it very hard, possibly painful, possibly painless, swelling, hard tumor, lump, or whatever in the breast, and it's usually fixed, non-mobile, that is a serious cause of concern. Please run to your doctor. Also, discharge from the nipple, especially a bloody discharge, because I know a lot of women, they may have little discharge either due to hormonal imbalance. It could even be normal, but when it becomes copious and is bloody or is purulent, that is, there is pus on you, and that's pus, this what's inside a boil or a blister that comes out and is very smelly and all that. Once it comes out of the nipple, then we know that is a serious cause of concern. Also, if the skin surrounding the breast is very hard and it's hard and swollen and all that, we call it peau d'orange. That is an orange peel, looks like an orange peel, very hard, and it's because of fluid accumulation in the skin, which we call skin edema, and we call it peau d'orange when it is hard and all that. The basic thing is, if there is any change in the size, shape, or contour of your breast has changed, the color, everything has changed concerning your breast, please run to your doctor. Now, concerning the question, stage 1 comes with the lump itself and is fixed.
Just hold on.
Okay, please.
Just hold on. What causes that lump?
Okay, what are the causes of breast cancer? Till now, breast cancer, the cause is still
unknown.
Not unknown. I won't say unknown. It is still should I say poorly understood, or we are just about to understand it, but scientists, researchers, doctors are still trying to find the breakthrough. However, there are absolute and relative risk factors of breast cancer. The absolute risk factors: number 1, age. The older you are, the more chances you have to have a breast cancer. However, young people nowadays are beginning to have breast cancer, and I will explain further. Number 2, race. They always say the white people are more prone to having all sorts of cancers because of the processed foods, these creams and all that, junk food, drinks, alcohol, smoking and all that. But nowadays, black people are beginning to have breast cancer too. One other thing is the low socioeconomic status, because they don't have the privilege to go to the hospitals to go for their checks. They don't have the privilege to see their doctors, and also they are more prone to having all these chronic conditions than others that are always visiting the hospitals regularly, checking themselves, and are more educated. However, the relative risk factors include: number 1, the commonest one is smoking. smoking is a very common cause
But
of.
for a
Yes, please.
woman who have not smoked.
Okay, I'm getting there.
Okay.
I'm getting
This
there.
is shocking.
Yes. Yes, of course. No, but the commonest cause is smoking. You will be so surprised that a lot of women will tell you, I don't smoke, I don't smoke. But when you go to the nightclub, you go to the bars, you go to the lounges, you see a lot of them smoking cigarettes, smoking hookah, smoking shisha, and so on. And all these, yes, they are all very, very dangerous. They cause all sorts of cancers. Please beware. Others include hormonal contraceptives. Not all contraceptives, and that's the reason why you need to always see your doctor to determine which contraceptive is best for you. Another thing is, they always say breastfeeding prevents cancer. So for those that have not given birth, they may have a risk of developing breast cancer. The reason why is breastfeeding. Not because a lot of people say the husband should do the work and all that. That one is still not determined. It's not fully determined yet. But breastfeeding has been found to prevent breast cancer. And I mean breastfeeding your baby, breastfeeding your neonate and all that. Not the other one that everybody wants to. I don't want to really go into that. And those are the absolute and another absolute cause is genetics, a family history. If your mom, your aunt, your any relative, especially first degree relatives, those are closer to you, if they have been diagnosed to have breast cancer, then you have a very high chance of having breast cancer too. And it's because the genes and the receptors have already been discovered, and they are called BRCA, BRCA, and hormone estrogen receptor. That's HER1, HER2, BRCA1, BRCA2. If you are BRCA1 or BRCA2 positive, HER2 positive, then usually the doctors even advise that you go for a mastectomy. That is, they should just as a preventive measure remove the breast, because they have the very high chance of developing cancer.
Is it those that have BRCA2? Okay.
Yes, BRCA2. Yes, BRCA2.
For BRCA1, they don't need a mastectomy.
Well, that's for the doctor to determine, because that's for the general surgeon and every other specialist to determine whether that person will still need a mastectomy or not.
Now let's talk a bit about the screening.
Yes, please.
Now, it's for some people, they feel like the moment I go to screen, right, what I'm not looking for is what I find. Right? So it's sort of like a fear that I was having a conversation with somebody, and I'm like, okay, so everybody talks about pap smear and all of these things. I mean, a lot of women are not doing this.
Yes.
Some are doing, some are not doing.
Some are not doing, yes.
But I think majority of people are not even there yet to say they want to take themselves to a cancer clinic to go and be checked.
Yes.
So how then are we able to tell majority that because the question is, oftentimes people are misled by treatments for cancer. Well, people may advise that they go traditional. Before we even do that, how do we even give ourselves ginger to go and be checking what is not missing?
Yes, that's true. One thing I believe is charity begins at home.
Okay.
So you have to start from the family itself. The husband should tell the wife, Madam, please, when was the last time you did a breast scan? If the lady is below 40, or if it's above 40, Madam, when was the last time you did a mammogram? Oh yeah, go to so clinic.
Let's go.
Let us go. Let us go and do that mammogram. Because I want to tell, I'm not scaring people here, but you know, the breast, yes, it's your private part, it's something that you really nurture and all that, but it's better you even take care of it now, and not the time when breast cancer, God forbid, breast cancer comes to someone and they start opening to every doctor and every specialist everywhere and say, come and see my breast, there's something wrong with the breast and all. It's better you even take care of it now while it's still private than someone having breast cancer and it now becomes public, and God forbid someone have to start sourcing for funds and saying they need treatment, 1 million, 2 million and so on, and start posting pictures all over social media. So that, I'm not scaring people, but it's just the reality. So like I said, charity begins at home. The husband talk to the wife. If you have a mother, take them for their routine screening. And also at work, just try the advocacy, start from there. By the time you talk to a colleague, the colleague talks to another colleague and all that. And also, like I said, I also appreciate Lagos Talk 91.3 for giving us this opportunity. Radio, television, media generally, either print or non-print media, and of course the social media too. And that's why we also have our social media platforms there: Facebook, Instagram, Twitter, even WhatsApp, even TikTok. We don't mind. We even go on TikTok and do all those video jingles and all that, and also all other possible means, even seminars, workshops, and all that, and even the religious bodies, the pastors, the imams, they should all, while they are doing their congregations and all that, they should also educate their people. Go for the breast cancer screening.
Pastors and imams should start telling their congregations.
Yes, it's very, very important.
I think there's a lot that the pulpit needs to start to do to be able to educate people more beyond the scriptures.
Yes, please.
Now, we're still talking breast cancer for women, but can men have breast cancer?
Yes, albeit very rare, but very, very possible, and it is even more dangerous for men. Yes, okay. It is more dangerous, and it is very, very aggressive. The cancer there is very aggressive. So men also just try and palpate your chest too once in a while. I do it even right now. I'm even doing it.
I'm trying to. Okay, you know what? Let's do an example. I'm doing live Facebook on Adeomi Oshodi Tapa for this conversation. So if you're on Facebook, go to Adeomi Oshodi Tapa and check. Now we're going to do a little bit of example for men and women, how they should using your
well, majorly women anyway.
Oh, please. Using yourself.
Yes, please.
And you're going to just sort of, how do we start from
the
home?
breast self-examination.
Yes, how do we do that?
Very good.
Oh yeah,
usually it's done after your period, after having your bath. You stand in front of the mirror. I will have to stand up now.
Stand.
Okay.
I can help you raise the mic.
So the first thing, they are God's gifts to you. You look at your breast. You are standing in front of the mirror. You look at the breast. You know how your breast looked like before. So if you see any changes and all that, you have to stand in front of the mirror, even turn side to side. You look at it, you check everything, and you make sure nothing is wrong with your breast. And after that, you raise your hands up. The reason why is because breast cancer, like I said before, it's invasive. So the breast, it sits on a muscle in the chest, and that muscle is called the pectoralis major. Even though there is a fascia, like a covering of that muscle, it sits there. So if the cancer spreads to that muscle, it will fix the breast there. Naturally, when you raise your hands up, the breast should move with it. But when you are feeling something pulling you down while you are raising it up, then it's a serious cause of concern. So if you now notice as you raise it up that there's a contour or a bending or something unusual about the breast, and you have to still turn side, it's not just to look at it and put your hand down. No, you have to look at it side to side. You have to check side to side. Sometimes they even say you should clap your hands just to be sure, because you are trying to grip the pectoralis. So if you now feel any pressure or any pain while you are turning side to side, you have to check too. Then you should run to your doctor. Also, some doctors say you can put a pillow under the shoulder that you now want to check, lie down, while some say there is no need, you can still check while you are still on the mirror. So what you just do, you start from the nipple and you now go in a clockwise or anyhow, just a circular manner, and you go outwards, and you just be massaging the breast and be feeling for lumps, for pain, even for discharge. That's why you have to start from the nipple, because as you are pressing it, if you now see the discharge, not the like a colorless fluid or something, if it's bloody, if it's purulent, or if it is just off and maybe even foul smelling and all that, then you have to run to the doctor. You just check, you just go circular and all that. And please, a lot of people, they just check the breast, they don't check the armpit. A part of the breast is even, it goes into the armpit, and that's, we doctors and anatomists, we call it the suspensory ligament of Cooper. It goes into the armpit, so you have to check the armpit. One other reason why we check is because the cancer, the first place it spreads to is what we call the lymph nodes. We call it lymph node. They're just like police checkpoints. it helps to, should I say, curb infection. Before the infection spreads all over the body, the lymph nodes will quickly close it up. And so before we start taking antibiotics. So for the cancer too, the lymph nodes will want to try and curb that cancer, but the cancer is just being renegade, and they swell and they now become more painful. So if you feel pain or swelling also in the armpit, those lymph nodes are beginning to be enlarged and is beginning to enter stage 2. So for that, you just have to quickly run to your doctor. And while you're doing for this breast, you do for the other breast, you do it every month. But however, please don't forget that the mammogram or your breast scan would still save the life faster, because those ones will even detect the smaller lesions, not because by that time you are feeling it has already become big. But if you do it every year, you will still detect the very tiny lesions that they can quickly take out. So that's just
hold your thoughts. Sit down, please.
Okay,
thank you for that. The Signals on 91.3. We're talking breast cancer awareness. This year's theme is we rise to ensure that every woman has access to the screenings she needs and the support that she deserves. Now let's look at the support system for somebody who already has stage 1 or stage 2 of breast cancer. What should their support be like beyond the funds? We know funds has to play a major role, but beyond the funds, what should people begin to know around them?
Okay, thank you very much for that question. Breast cancer, it does not only affect the patient, it affects relatives, it affects family, it affects everyone that surrounds that particular person. And that's why we need to give them all the physical, financial, and even psychological support that they need. Many of them become depressed, many of them become anxious, many of them become fretful, many of them fear the known and even the unknown, because a lot of people, yes, of course, breast cancer could be a death sentence, but not always. If you detect it early, it's not a death sentence. Stage 1, stage 2, if they do a mastectomy, you may still survive even more than someone that just had an accident on the road. However, if it now becomes stage 3, stage 4, that's when we now start believing or having the fear of the unknown and so on and so forth. But please, we need to give them that support while they are talking to their doctor, especially the husband, because I've heard a lot of stories that the husbands abandon their wives because their wives had breast cancer. No, while you were enjoying those breasts when they were still good, why will you now abandon your wife because she has breast cancer? It can happen to anyone. So please, we need to give them that moral, physical, psychological, emotional support. They need it at that particular time. Please.
You need to. I wish. Now I'll tell you why I'm laughing, because when you say that, when you're talking about how spouses are abandoning their wives,
Yes, please.
what do you think is the cause for a man to abandon their spouses during these times that they have? Because I think we need to check what's wrong mentally first.
Actually, one of the I'll talk about the physical part before I go into the psychological. One of the symptoms of breast, apart from the discharge, the lumps, and even when it now starts forming scars and the lesions and all that, it decolorizes the skin and all that. Apart from that, one very common symptom of breast cancer is that particular foul smell. Breast cancer, when it reaches stage 3, stage 4, the smell is out of this world. So you can imagine a man sleeping with a woman at night with breast cancer, and the smell is even all over the house. Okay. I know that particular smell right from my medical school days. It is worse than rotten egg. I categorically say that. It is worse than rotten egg. So I may not really blame them down, but at the same time, you shouldn't abandon them because of the smell. It can happen to anyone, and of course the fact that it is the color has changed, or the wound, the lesions and all that, the husband that has been enjoying this particular breast while it was still okay, the breast has now turned into a monster and all that, the man will just you know, emotionally the man will be like, no, some men are even so, I don't want to use some languages here, some men are just so bad that they now start saying there are many fishes in the ocean, and they now start going around looking around.
Do we
and all
need
that.
to have a meeting where men need to begin to sit down, talk about how they can help ensure that they're supportive to the spouses? Because if you have enjoyed a certain breast for a very long time and it's suddenly becoming, things go bad, right? We all don't pray that starts to go bad. But what's their response? Because I realize that for people who have cancer, well, yes, they need support system, but the people that they rely on to give them support system are not bankable.
Thank you very much for that. This is the reason why, I'm sorry to say this, many health practitioners make this mistake of just giving breast cancer sensitization and awareness to only women.
Okay.
Me, I prefer to have my seminars and workshops with both men and women, so that the men, when they hear all the signs, symptoms, causes, and all that of breast cancer, they will quickly run down to their wives and tell them, madam,
come on, be going.
Please,
Let's be going.
let's just go and do this. I heard that breast cancer, it killed so. It killed this person, it killed that. Oh yeah. Start going to so
let's
clinic.
Be going. Be saying, let's
let
be
us be
let
going.
us be going.
And that's the truth, because the man may even say go. I may not even follow the way. If the man should also give that support, follow the woman, do the mammo and all that, and see how it is done. And they do it every year, and that one is also a preventive measure to curb this breast cancer scourge. So please, it's very, very important. You have to educate both men and women, not just the women only.
Okay. And the numbers to call if you have questions for Dr. Olorunfemi.
Laguda, Olorunfemi, Idris.
Okay, call us 009-234-5913. Send us a WhatsApp message 009-234-5913. Call us 009-191-3913, 009-222-0913. Send us a WhatsApp message 009-234-5913 if you have questions for him. Again, this year's theme is we rise to ensure every woman has access to the screening she needs and the support. Because I really want us to again talk about the support. There's one thing for the spouse. What about the children? What about the families? How then are we able to educate a much number of people around this person?
Like I always say, charity begins at home. So the children
too begins at home. It's sometimes hard because when a mother comes home and says that she has breast cancer, hold yourself.
Okay.
Oh, hello, good morning.
Hello.
Hello, good morning.
Yes, good morning, Doctor. Doctor in the house.
Yes.
Good morning, Ashodi.
Good morning, sir.
Yeah, my name is Alex. So you said something about this, and I think it's quite important for this awareness for majorly our women. And you also say it can also happen for men, but I think the ratio is quite low. I've never heard of men having such things, except maybe of the lungs and other parts of the body. But I want to ask a question.
Okay.
You said exercise is not quite important for especially the women to be able to reduce this cancer. Okay.
Thank you. He's saying, Alex is asking, what about exercises to be able to prevent?
Before I quickly answer that question, I would like to say, like I said before, breast cancer very rare in men. It's not that common. It is very, very rare in men. But if it occurs in a man, it's even more dangerous than in a woman. So that's by the way. Exercise, yes, very, very important and very, very lovely. A 30-minute walk every day is even enough. You can jog, you can cycle, you can swim. In fact, swimming is a very, very good form of exercise. And the reason is this. You see, when we eat processed foods and all that, junk food, fizzy drinks, and women that smoke and all that, the body tries to metabolize all these toxins and it develops what we call free radicals. So exercise naturally burns off these free radicals, and these free radicals are implicated in cancer generally: breast cancer, colon cancer, liver cancer, lung cancer, any form of cancer. So exercise on its own burns off all these free radicals. It keeps you healthy, it keeps you alive, it keeps you joyous, and it keeps you very okay. So exercise is very good for the body.
Okay. Have you ever had a case of where the person did not do anything right? She did not smoke. She was not in anywhere where people are smoking to inhale
Yes, please.
smoke, and then has breast cancer.
Yes, that's why doctors, we really need to take a very detailed history. We need to take a detailed history. We need to do a physical examination, because we'll ask a lot of questions. We'll ask for the family history, whether the mom or aunt or anybody has had breast cancer. We'll ask for the kind of occupation that they were doing, because people that are exposed to chemicals or ionizing radiation and all that, they may also be implicated to have breast cancer. And people that have used bleaching creams, any form of hard chronic drugs, or what's the other one again, either drugs, creams, or any form of toxin generally, if they have been exposed to that, then they may have that may be the cause of breast cancer. One other thing is the kind of contraceptive that they use. There are some contraceptives that may be implicated in breast cancer, while there are some that are not that implicated. So the doctor will just have to ask a lot of questions, and if after asking all the question the woman says no, then of course it's open to research. That's why we have professors, that's why we have teaching hospitals. We usually refer those to tertiary centers, and it's still subject to research.
Okay, so there's still no cure to cancer yet?
A definite cure for now, none. So the only way, early detection is the key to achieve a cure. What doctors do, we don't really want to cure, but we want to achieve it. It's achievable. I know of a woman that we nipped it in the bud for her at stage 1. The lesion was very, very tiny, and when they removed in fact, there was no need to remove the breast. They just had to remove just a part of the tissue that was present in that mammogram. And till date, she's cancer free.
Okay.
Fine, she used chemo and some other things, but till date she's cancer free. She has not had any form of cancer again. So early detection saves lives. Early detection is the key to prevent or even achieve the cure for breast cancer.
Let's go back to support again. Support, because it's very key.
Yes.
Before we continue on the support, does Nigeria hospitals, let me try, because half of our doctors are going, thank you that you're not even going to right?
I always say charity begins at home. If I leave, who will take care of the Nigerians? So yes,
is our hospitals equipped to be able to handle all of this?
There are some hospitals actually that are equipped, not all, and this is why I have to advocate to the government to try as much as possible. I know the government is doing very well concerning healthcare, but they should still try as much as possible to equip these hospitals. You know, there could be a public and private sector partnership where the government would supply all these devices, machines, and medical appliances and so on to detect, prevent, and treat breast cancer. And also the trainings, I'm also trying to advocate to doctors to go for trainings in either interventional radiology or radio diagnostics or radiotherapy, and also oncology, because there are not many consultants that are oncologists or interventional radiologists. They are very, very rare. So doctors should still gather that interest and just try to go for all these specialties, so that if we have more doctors doing this, I'm sure we would see a lot of patients that will be treated for breast cancer.
And let's go back to support. Because I'm very keen on support, because it's new for some people. Yes, it's a new terrain. How do they begin to handle it? If I'm going to tell the next person that I think I have breast cancer, I don't want people pushing me into fear that, oh, that's a death sentence.
Yes.
So
okay. This is the reason why usually many oncologists and interventional radiologists, while they are doing their bits, they always invite either the clinical psychologist or, if possible, even a consultant psychiatrist to counsel them, to talk to them while they are given the chemo, because of course chemo has its own side effects. So apart from the baldness and myelosuppression and so on and so forth, they have other psychological side effects too. The woman will become depressed, anxious, judgmental, and all that. So
why me?
why me, and all that. So when this clinical psychologist comes in, counsels them, talks to them, do some form of psychotherapy for them, I'm sure that will go a long way to also give the medical support that they need. Because many doctors, they are not really, they just want to prescribe drugs, just give their radiotherapy and go and say, okay, come back next week. And they will feel so unwanted and so unloved. But when the clinical psychologist comes in, talks to them and gives them clinical scenarios and all that, and you'll be like, okay, isn't it better you detected it at this time than when it's already stage 4 and the 2 breasts are already gone and liver, lung and bone, everywhere is already gone, so and so on and so forth. So the clinical psychologist has his or her own way to deal with this.
Okay, let's talk about Gen Z. Gen Z, they have a lot of energy.
Yes, please.
Now, what can we begin to tell them early so that we avoid future errors? Because you talked about shisha, you talked about smoking.
That was even the very first thing I wanted to say.
Yes,
please,
because I see a lot of women and it's worrisome.
Smoking. It is very important. Stop smoking. Tobacco has 1,001 carcinogens. Carcinogens are toxins that cause cancer. They are still discovering more.
Okay.
Scientists are still discovering more day by day. So why are you just, and especially shisha, you see young women and they blow it and they feel so irate, they feel so good, they feel on top of the world, and they don't know that they are killing themselves. So please, let us stop smoking. Smoking on its own. If you can stop smoking, we have already reduced the chance of having cancer by about 40 to 50% already. Before you now start saying, okay, you want to exercise, you want to eat good food, fruits, veggies, avoid processed food, avoid fizzy drinks, avoid all these chemicals that we're just eating and drinking and all that, and living a healthy lifestyle generally. So, and of course, all these cream, soaps and all that. So that's that.
Yeah, you're doing well. Because I've had almost 45 minutes talking breast cancer. Now, would every case of breast cancer require surgery? Because you are telling us to go and do early detection.
Yes,
I'm not going to walk into the hospital.
Well, surgery is a double-edged sword.
Okay.
And I'll explain. It depends on the doctor. The doctor or the surgeon will determine by himself if he now wants to go ahead with the surgery, either at the early stage or at the late stage. In the early stage, it's possible that just giving chemotherapy may just cure the cancer, even at the early stage. So there may not be need for a surgery. Even if there may be a surgery at the early stage, just be a minor surgery. Just make an incision, take away the lump or take away that lesion around there, seal it, and go for your chemotherapy or radiotherapy or whatever, and you are cancer free. And also, when it is at the advanced stage, when the cancer had already spread to liver, lung, and skin, bone, everywhere, of course, some surgeons just believe it's already stage 4. Within the next 2 or 3 months, person may just succumb to it. So what's the essence of doing a surgery? And some surgeons may just be, okay, let's just try our luck. Let's see if we remove it, give some chemo, let's see whether it would work. So it just depends on the surgeon. The surgeon usually decides. Yes, please.
Now, speaking of surgery, when they say that you have 6 months to live, how on earth does a doctor know that somebody has 6 months to live?
It's based on experience, actually.
Okay.
Because I don't really want to say this, but my mom died of cancer, not really breast cancer, and she was told that she had just 6 months to live, and she succumbed to it before that 6 months. So that was my very first experience with a cancer patient. Even that was when I was in medical school. And while I was in medical school, I saw a lot of cancer, generally cancer patients, breast cancer, colon cancer, and all that. And when the consultant told them, this man just has 3 months to live, usually 6 weeks, the person is already gone. Because he has already seen it, that it has already spread to the liver, lung, kidney, and also they just give that longer period, but they already know the person may even die before then. So
okay,
yes,
nobody's dying this morning anyway.
No, not at all. Yes,
for somebody who is living with cancer, now generally cancer, what will you tell them?
Cancer is not the end of the world.
Okay.
Yes, it is usually not a death sentence. Early detection saves lives. And even if you are in stage 3 or stage 4, it's not the end of the world. There's always light at the end of the tunnel. Okay. We medical practitioners, we are still here. We care and we love you, and we are always praying for you and just hope for the best. I know it's not easy taking the chemotherapy, vomiting, and the hair loss and all that, and also the radiotherapy, the burns and all that. But I just wanted to know that we medical practitioners, we are always there for you. We care, and this is also an avenue for you to also educate others too, to advise people to always go for their checks, do their breast self-examinations, go for their screenings and all that, so that they may not end up like others that have already succumbed to it.
Thank you so much.
Thank you.
Thank you so much. Thank you for giving me almost 5 minutes of your time and talking about breast cancer. Now again, yes, before we forget, this year we're rising. All of us are rising. To ensure that every woman has access. Access is very important. Access to support, access to screening that she deserves, that we deserve. And when we rise, we're rallying screening for everybody. Thanks to Lily's Women's Health. I had to call Megan yesterday. I had to pull a James Bond yesterday because I wasn't going to allow this pass. So we come your way again next week Saturday, like we always see on Signals. Dream again, create opportunities for people. And please, men, in as much as you like to suck breast, and I'm being very explicit this morning, follow the women in your life to go and do screening, because by the time it starts, all the money that you are keeping would go to it. So ensure that you follow the women in your life. It's compulsory that they go and do early screening. Early screening is better, right?
Yes, please. Early detection saves lives.
Have a wonderful week, and God bless.